So our next speaker joining us today is Dr. Mahadeo Sukhai, who is the Head of Research and Chief Accessibility Officer of the Canadian National Institute of the Blind. So thank you. Without further ado, Dr. Sukhai, please feel free to join us.
Thank you very much, Anna. It's a great pleasure to be here today to chat with everybody. I'm just sharing my screen. Okay, all right. So hello, everybody. Good morning, good evening, good afternoon, wherever in the world you are. It's a real pleasure to connect with you today and have this conversation. I did notice in Anna's list of participating countries that my country of birth is listed, Guyana. So whoever is from Guyana, friendly hello to you. As Anna said, my name is Mahadeo Sukhai. I am the Head of Research and Chief Accessibility Officer for the Canadian National Institute for the Blind, an Assistant Professor Adjunct in the Department of Ophthalmology at Queen's University, and the Principal Investigator of the project Creating a Culture of Accessibility in the Sciences. I'm presenting this work on behalf of myself and my co-principal investigator for that project, Ainsley Latour. And it's a pleasure to be here at SciAccess 2020 and to have Anna invite me back. Most of my slides, just so everyone knows, are actually plain text. There are a couple of instances where there are some graphics that I will describe to you. So just to hold on a moment. I'm providing on slide number 2 my email address, which is very simply mahadeo.sukhai, mahadeo.sukhai @cnib.ca, and also my LinkedIn profile, because you can find me on LinkedIn if you just search my name. Just to recap from last year, when we chatted in Columbus, we talked about accessibility and inclusion in STEM being more than the provision of educational materials in accessible format, which is where the conversation usually honestly begins and ends sometimes, particularly for individuals who are blind or individuals who are visually impaired or individuals who are deaf or hard of hearing. However, multiple frames of reference really need to be taken into consideration in the creation of inclusive content. And this means frames of reference based on lived experience, frames of reference based on one's neurodiversity, one's experience with chronic illness, one's experience with sensory disabilities, but also where one comes from in the world and how one interacts with the world. Often what gets left out of the inclusion in STEM conversation is the conversation around inclusive supervision, mentorship and sponsorship, as well as creative technological solutions to accessibility barriers. And Caroline's presentation is a great example of that. Last year, we talked about 3 models of universal design: physical universal design for learning, and universal design for instruction, and also a model that Ainsley and myself and a couple of our colleagues developed, which we refer to as cultural universal design, or universal design of social interaction or personal interaction in the education space. We live in a world today that's been substantially impacted by COVID-19. And this is true in STEM. Scientific meetings have been canceled, postponed, or like this one, are entirely online constructs. In many places in the world, there are no gatherings of more than 5 people. Some places have started to relax the rules and have said 10 people or 20 people are okay. But you think about that, and what that means is we're canceling symposia, we're canceling colloquia, we're canceling seminars, or we're moving all of these things online. Post-secondary classes are online. K-12 classes in places where we can actually do that are also online. And limited in-person research can be undertaken. Theoretical research has been, I think, less affected than experimental research, but a lot of institutional research ethics boards right now are only talking to us if we have research that is relevant to COVID-19. In many places, there is universal masking and physical distancing rules. Everyone is facing challenges. This is one of those slides with a graphic, and it's a very simple word art. There are 3 boxes that are headlined by faculty, students, and service providers, and I will read you the contents of the boxes. Faculty members are struggling with familiarity with online learning systems. They're struggling with their relative comfort levels with online work and supervision. Implicit biases around what we call presence-based work, or the idea that you have to be physically someplace not named your home office, which I am in right now, in order to work effectively. Implicit biases around online being easier. If there's time, I'll tell you a funny story about that. Funding sources for grants have dried up, and that's true for scholarships as well. And research programs have had to have been transitioned virtually as much as possible. Students are struggling with learning online. Working and learning from home, where many haven't really been equipped or set up to do that. Students are struggling with inability to continue in-person research or practicum placements, with accessibility challenges in COVID-affected environments, and as I said, their scholarships are on hold. Service providers are struggling because accommodating online is different from accommodating in person. Familiarity with online resources is a challenge for this population as well. There's a different accommodations buffet, in gigantic air quotes, that has to be used. The accommodation solutions for online education are different than for in-person education. Service providers are having to work remotely. They're dealing with accessibility challenges in COVID-affected environments. And as post-secondary campuses start to think about going back, service providers are struggling with return to campus planning that doesn't take accessibility into consideration. So this has a series of effects on students with disabilities in STEM. And again, this slide has a graphic with 3 boxes: positive effects, negative effects, and ambiguous effects. There are some positives. There's access to more online content. There's greater opportunity to virtually network through conferences like this one. And there's access to virtual labs and simulations and resources that will support learning in that way. But there are a lot of negative effects. There's the loss of access to in-person teaching and research labs. There are some significant transition barriers for anyone who's graduating, moving into a postdoc, trying to get a job because of the pandemic. There are barriers to degree completion at the master's and PhD level if you can't complete your research. As I said, there's impeded research, and there are so many barriers to individuals with sensory disabilities as well. There are also some effects that are neither positive nor negative, but really depend on how somebody is actually taking them up. Online classes can be a good thing or a bad thing, depending on how the instructor develops the learning. Online meetings or conferences have had accessibility barriers, and SciAccess 2020 is a fantastic example of how to do this right. And inclusive virtual supervision, again, could be both a barrier and a benefit, provided that folks actually know how to engage in it effectively. There has been, and there continues to be, cross-disability impact. And the slide that is on the screen now actually shows a stylized pie chart. Each slice of the pie contains one of the ways that there has been cross-disability impact. As I said, we have impacts on learning, and so different ways of learning are being impacted by online learning and online education. Communication with team members, if you're deaf and you have to wear a mask. Navigation and wayfinding and all of the physical distancing markers that are out there, very few of them are actually tactile. Guide dogs can't social distance. It sounds trite, but it's true. Prolonged isolation and the impact of prolonged isolation on mental health, disruption to routines, and again, the issue of inclusive mentorship and supervision and networking when one does this primarily online. Thinking about solutions. One solution would be to create a repository of inclusive online STEM education resources. Another would be training and resources around how to effectively work and learn online. Think about resource guides around inclusive virtual meetings and inclusive virtual supervision. I'm sure between what Kumiko-san and Anna and my team has been able to develop and learn and apply, some of those inclusive guides are going to be very easy to put together. Virtual supervision, as I said, and how to do virtual supervision well is another resource guide that we've been working on. It's really important to upgrade policies and practices, which are currently very in-person centered. And to understand the impact of COVID-19 on students, faculty, postdocs, and teaching staff with disabilities is also really important. It's really important to realize that we're all in this together and the importance of collaboration. We learn as we go along, and we learn from each other. A new environment means new rules and new ways of functioning, and it really requires us to rededicate ourselves to the universal design principles that I identified earlier: physical universal design, universal design for learning and universal design for instruction, and the cultural UD model. I am going to end this conversation by talking about expanding the conversation and picking up on a thread that Anna mentioned in her introduction, and talking about the ways that we can expand the conversation. This slide has a graphic that has 4 boxes with vertical titles: conferences, networks, mentorship, and expert initiatives, and arrows connecting each of those 4 boxes. In the conference box, I'm identifying conferences such as SciAccess 2020, the Multiple Perspectives Conference that OSU hosted in April that was also entirely online, and a conference that I attended 2 weekends ago, the Stanford Disability and Healthcare Conference, that I've participated in over the past, actually 4 months since the pandemic, that have actually touched on the conversation around accessibility in STEM. That last one, the Stanford Disability Conference, really tackled it in terms of healthcare. In terms of networks, as Anna mentioned, the SciAccess Working Group and the Facebook group, AMPHL, which is the American Medical Professionals with Hearing Loss Organization, and an organization that I'm involved in starting up, which is currently in its very formative stages, which is the network of researchers with vision loss in the biomedical sciences. I've participated in a couple of mentorship opportunities over the past few months. Both of these are Canadian oriented, but I'm happy to do things internationally as well, and have done profiles for the Let's Talk Science Partnership Program Community Outreach Initiative based in Ontario, and the Science to Business Network podcast initiative as well. Lastly, expert initiatives, I highlight the work in disability and healthcare done by Lisa Meeks at the University of Michigan. And I also highlight something that Ainsley and I have just started to set up called Idea STEM, inclusion, diversity, equity, and accessibility in STEM, which builds on all of our expertise and perspectives in order to launch a resource much like C3D, which will provide solutions to accessibility challenges in the STEM space. Thank you very much for listening to me today. Happy to take any questions if there's time, and also to participate in the group question period at the end. Back to you, Anna.
Thank you so much. I really appreciate that. We do unfortunately have to move on to the next speaker, but hopefully there will be some time at the group section at the end. So if you have any questions, please feel free to still submit them or hold on to them until then.